Hi Andy, I'm Dr. C. Suman, consultant pediatrician, Ankura Hospital. The common issues, some other common issues which we see as far as babies' breathing patterns are concerned is sometimes the babies breathe very heavily at night. There will be a lot of noisy breathing. So when we should be concerned, when we need not worry. So if you look at the baby, if the baby has fed well, is undisturbed sleep, the sleep is not getting disturbed, and the baby is otherwise daytime activity is absolutely fine, we need not worry as far as a noisy breathing at night, because it can cause nasal snuffles. It may be because of a mild nasal blockade or dryness of nose. These would be the reason. But sometimes the baby starts breathing with its mouth. The baby will be breathing quite heavily and there will be a lot of noisy breathing. There might be drooling of saliva, or suddenly the baby might get up from sleep with ear pain, or there might be watering from the eyes. Overall appetite might be disturbed, the sleep might be disturbed in a longer run. These are scenarios where we need to think that there is a problem. It can be because of blockade in the nose. We call it as nasal turbinate hypertrophy, means swelling in the nose, or it can be because of a condition called as adenoids, which develops at the back, adenoid hypertrophy, which develops at the back of the nose. What happens at the nose, back of the nose, there will be certain immune organs called as adenoids. Whenever the child is getting repeated infections, the adenoids get swollen up and they block the nose. It doesn't allow the child to breathe, and the child is forced to breathe with the mouth, and that's when the child will have all these problems. So they need to be evaluated quite soon, and they needs to be looked into and treated quite fast before the child suffers more. And there might be issues with the throat as well. We call it as laryngeal disorders, or there might be issues with the lungs, where the child will be having noisy breathing whenever the child is breathing out. We call it as wheezing. So we need to evaluate what is the cause. As long as it is not disturbing the sleep of the baby, overall health of the baby, then we need not worry. But if the sleep is disturbed, overall health is disturbed, the weight is getting affected, the child is frequently visiting the doctor for various reasons, or the child is breathing with their mouth, then that is a time when they have to be evaluated completely by the pediatrician, the ENT surgeon, and if necessary, a pulmonologist. Thank you.